So the Health Equity Working Group is a new endeavor for the Global Health Council. We've recently invited about 40 organizations to join this working group. They're all based out of country offices in low and middle income countries. And right now we're actually co-creating what this working group is going to look like, what its priorities are going to be, and what kind of advocacy activities we're going to focus on. So this working group is going to focus on a very global audience. We're looking at targeting various different countries from around the world, but mostly in low and middle income countries. We're also looking to target multilateral agencies. And like many of the other GHC working groups, we're going to be working with various other advocates and partners to help us with our work. So organizations and advocates that are interested in advocating around key health equity issues, many of which we've started to identify within the working group. One of those includes making sure that we're increasing access to health services, particularly for those marginalized and vulnerable communities. We're also looking to advocate around improving quality for those communities as well. Making sure that there's appropriate health financing for health equity, looking at primary health care as a way to make sure people have access to health services, and those are only a few that we've started to brainstorm. So in this working group, we're starting to identify which advocacy activities we want to focus on for this year, and we have a few in mind. Some include meeting with different technical experts, also with policymakers, and even with leaders of multinational agencies. The other is creating briefs and advocacy messaging that we can share with those stakeholders, but also with other advocates that can take on some of our advocacy in their ongoing work. And then also really important for us is to share the experiences of people that have faced a lot of health equity challenges around the world. So the Health Equity Working Group is also an endeavor that Global Health Council has taken on to not only diversify its membership, but to also bring in those voices from the country and regional level, particularly among people who have lived experiences, and giving them a platform to really share what those challenges are and provide their recommendations for how governments and other stakeholders can address those challenges.